everyone, we're back at it again. We're here and it's another episode, which means it's time to once again discuss mental health and how we can start going about normalising and validating this aspect of our everyday lives. Jamie here, and I feel like there should be a drum roll for my colleague. We've got Michelle here with us today, who's joined us for her long-awaited debut. Michelle, you're here, you've made it. Does it live up to the expectations?
Yes, it does. I've eventually made it. It's taken 2 months, but I'm here. Amazing to be here. Listening to the shows up to now, they've been great. Lots of information, a fair few comedy sketches, but it's been brilliant to hear it come to life.
Right, no, it's glad to have you here as well. So the hearing yourself probably takes, that's probably the hardest bit. That takes a bit of getting used to, but it doesn't make it any easier. It can be quite distracting, but wouldn't worry about it. I'm always getting told that I sound like I'm on Clyde 1 Super Scoreboard. Don't know if that's supposed to be an insult, but if the people are talking about it, then it means that they're listening. So I view it as a positive.
Definitely a compliment, Jamie. You're doing amazing.
Brilliant. And I did not tell her to say that. That's not in the script. I left that open for yourself. Exactly. You've passed. You're allowed to come back.
I'm looking forward to today. Lots of interesting information coming up.
Yep. So on today, we're going to discuss the concept of stigma and the barrier that this can pose when working with mental health. Later on in the episode, we have a guest from the Lanarkshire Links team who also is part of the Stigma Free Lanarkshire project. So this is going to be really valuable in discussing their view on stigma and the work that they're doing in the community to help combat it. So definitely stay tuned for that one. So for now, I want to discuss the idea of normalising and validating someone's feelings. This is a big part of the support when working with mental health, and it can help to build a healthy relationship with yourself. And you've probably noticed, Michelle, I've said that word a couple of times already. I've used that word normalising, validating. What's your thoughts on that word?
I actually have a favourite quote. It's by Morticia Adams saying, "Normal is an illusion, so it's normal for the spider, it's chaos for the fly." And it's totally true.
Nice
what is normal? Is it striving for something that doesn't exist? Is it setting unrealistic expectations of ourselves and others? Is it the pressure of trying to be normal just adds extra layers of stress and frustration when striving specifically to fight against the reality of how we're actually feeling in that moment?
Yeah, that's a good movie reference as well there. I think you hear a lot when we're working with people as well in our service that we discussed in episode 3, people saying that idea, I just want to be normal. The pressure that statement can bring, it can be such a barrier to moving forward. And I suppose we can start with looking at most of the coping strategies that you're going to find online will be mainly managing these thoughts and feelings, not necessarily stopping them.
Exactly, Jamie. I mean, we can give ourselves such a hard time for not being able to stop our mind from overthinking and stop ourselves from feeling sick with anxiety. Then all of a sudden, it's not just anxious situation we're dealing with, but then worrying about worrying. Then we get so frustrated with ourselves for actually worrying, we then feel agitated and it just becomes a vicious cycle and it gets out of control and it can take over our lives.
Yeah, it just kind of goes from one thing to the other and it just starts to spiral from there. Absolutely. So what do you think about this? What do you think would help with this then, Michelle? So for example, if I was somebody who'd came to you, I'd been maybe deferred in or just kind of talking to you as a friend and I was saying stuff to you like, why can't I just be normal? You know, everyone just seems to know what they're doing. I feel miles off it. How would you look to approach that with myself? Okay,
well, first of all, there's no such thing as normal, so I'd reassure you there. What's normal for me isn't normal for you, and see if we were all the same, life would be pretty boring. I feel using like a person-centred approach for each individual, getting a better picture of what's going on in your life, agreeing on what we can work on together, working through your action plan, and then we would start to ease these anxieties and negative thinking and look at introducing coping strategies to improve these.
Yeah, I think what you kind of touched on there is really important. I'd be probably along similar lines to yourself. You need to look at what that perception of normal is for that person and how that's then impacting yourself, because there is no fixed definition, you're right, and if we all had the kind of same ideas, the same points of views, that world would be a far less interesting place than it is now. I'd probably say the closest thing to the definition of normal we have in most cases is what the majority of people in society believe is good and bad. So looking at research carried out specifically by the See Me team, who are big advocates for challenging stigma, they found out that across Scotland, 71% of people with a mental health condition have experienced stigma and discrimination. Furthermore, they can add to that as well, if 1 in 3 people in Scotland experience mental health problems, and around 2/3 of those face stigma and discrimination, that's over 1 million people in this country who are being treated unfairly when they're struggling. And they've also got comments as well saying that it was mainly the idea of being judged that was stopping them from asking for help. So that's a couple of statistics there from yourself. What do you make of those?
Yeah, it's a large number, isn't it? It's actually frightening that some people are so scared or worried of the fear of judgment or discrimination it stops them from actually seeking help. My own opinion on this is we all need to start talking about mental health more. Get rid of the stigma and the thinking pattern of, oh, we'll just try not to worry about it, everyone's going to be fine, when actually we know ourselves we need help, and take those steps to reach out.
Yeah, no, I agree. And the worrying thing is that unless unless it is addressed, that stigma and that judgment towards mental health, that almost becomes perceived as the normal behaviour. And if that just becomes that's just the way things are kind of attitude, then that can be a massive setback in taking any step towards normalising actually talking about our mental health.
Yeah.
So as promised, we have Lorraine joining us today. She's involved with the Stigma Free Lanarkshire project as part of Lanarkshire Links. Welcome, Lorraine. I nearly called you Michelle there, that's my colleague is here. So how's things? Is this something you've done before?
Things are good. Things have been really good, particularly for Stigma Free Lanarkshire. As for a podcast, our team, I wasn't directly involved in it, but our team, so we've got 3 other people in the Stigma Free Lanarkshire team. We've got David, Audrey and Gerald. And David and Audrey carried out their own podcast with one of our volunteers and members, Liz, who has got quite a powerful story in relation to her mental health and her journey of recovery. So they were able to do a podcast with Liz, and that was presented at the recovery event, which was held at the Alona House in Strathclyde. It's on our website, so if you want to have a look at it.
Check that out.
It is, it's really good. So that was our first experience of a podcast and being able to share any stories in that way. It's actually been really powerful, not only for our organisation as well, but for Liz and part of her recovery journey, being involved and being able to tell her story in a way that was really new, exciting and fresh, I think made such a big impact on her. And not only that, the podcast was played at the recovery event back in November. And again, the response that she got back from that, and we've obviously shared that on our social medias and stuff like that, the response that she's got for that has just been phenomenal, as well as lifting her well-being as well. Yeah. So it's a really positive thing to do. So we're not against it. Just nervous, but not against it.
No, and I think you've kind of touched on that main point there. And that's the kind of modern way of things. I was saying that, saying that kind of coming up the stairs there, and it is exciting. It's the kind of new way of doing things, and it does give people a platform to share their story.
It really does. And I know just when I'm working in the office at Stigma Free, most of the team, as they're working, they've got their headphones on and they're listening to podcasts. So it does seem to be a really genuine way to get a message and a story across. Yeah,
it's the way of the world, and it's really nice to hear positive feedback after sharing such a powerful story on the podcast as well, because that's what we're talking about today. We just spoke about that idea of stigma and how to challenge it, and a big way of doing that is by speaking out about it. Speaking out about it. So thanks for kind of coming on and joining us. It is, it is an important matter, battling that concept of stigma. So are you able to give us a little bit of an insight into the project and the work that you do with your team in the community?
So Stigma Free Lanarkshire has been since about 2016. We work alongside and with NHS and Health and Social Care. We're partly funded by them, to be fair, so we're in quite a good position. I think also when you think about stigma, the reason why our organisation is in such a good position at the minute is the fact that when it comes to mental health and mental illness, stigma plays such a phenomenal part of that process, whether that be reaching out for support all the way through to recovery. Because if people are stigmatising themselves or they're being stigmatised by other people, it's really hard for them to reach out and get support, because they've got their own thoughts in their mind about why I can't do it. Well, I need to be more manly, I need to do this. Or they've experienced another family member who has a mental illness. They've seen how that person's been treated, so they think, well, if I reach out for support, I'm just going to get the same treatment, which is why actually it plays a massive part in the mental health and wellbeing strategy for Lanarkshire. Okay. Stigma is one of the big strands within it. Yeah. Because if you don't address that foundational elements of being able to reach out for support, that's half the battle done, being able to do that.
Yeah, absolutely. And it can be really isolating. You're getting stuck in your own head with your own thoughts, not knowing that there's support out there. It can be really isolating.
It is, aye. So we work across 4 areas because ultimately what we're hoping to do is be able to, in an ideal world, we would eradicate stigma from the world. And to do that, we've identified 4 key areas. So that's the workplaces. We've got communities which we work within, health and social care, obviously being a big part of our role, and then also education and young people. And from those 4 work streams, we've had some fantastic opportunities and some fantastic pieces of work that we've been able to do. Do you want me to talk about them?
Yeah, absolutely.
Because I'm on a roll. I'll just go straight.
That's what you're here for, absolutely.
In workplaces, what we've been doing is working with a particular workplace at the minute, and they've been analysing and surveying the staff and speaking to the staff about their experiences within the workplace of mental health. trying to assess where the policies are at, where the processes are at in relation to mental health and where stigma falls into that. Just now they're at the part of the process where they are creating an action plan. So they've been able to identify the areas where there is weaknesses, because every workplace is going to have its own
absolutely
nuances.
And you need to know what it is, what the weakness is, so that you know what it is that nobody's perfect.
Absolutely.
We speak about that.
So they're at the point where they're doing their action plan, and then we'll come together with them and work out how they're going to address that action plan and the things that they're going to put into place to be able to address it. So hopefully that workplace is one where they'll be able to address and reduce the amount of stigma that's associated with mental health there. We are working with a number of community organisations at the minute. We're working with one in particular called Cocoon Minds. So that's a charity where it's predominantly focused on mental health and wellbeing of people from the South Asian community within Lanarkshire. And that's quite exciting because they're quite new. So they're really passionate about addressing any issues associated with mental health. And they've got a couple of events coming up, one at Forgewood Community Centre, where they're having samosas and chai and just having the opportunity to talk about mental health.
And that's in Motherwell, isn't it?
Yes, and then I'm not sure where this one is, but I know that they've got one coming up on the 16th of March where they're actually going into the Gurdwara.
Okay.
Bringing in speakers to talk about mental health, as well as us from Stigma Free. We'll be there doing a talk and being able to talk about some of the stigmas within their own culture that prevent them from getting support and help.
Brilliant. So you kind of mentioned a couple of places there who are using yourself to kind of challenge stigma in the workplace and in the community. How do people get in touch with yourselves to kind of start that form of support?
Just through our email address, to be honest with you. SFL, so Stigma Free Lanarkshire at lanarkshirelinks.org.uk. I would say that's the best way to reach out and see what it is that we can do to support them. Because the thing is with Stigma Free is we're not necessarily a user-led organisation, so we work with the bigger picture really to be able to make things better for the service user in relation to reaching out for help. I'm trying to think communities, health and social care. So we have our champions.
I'd seen that. That was on my notes. I'd been stalking your website beforehand and I'd seen something come out about a Stigma Free champion, so I'm glad you brought that up.
So the Stigma Free champions, the majority of them, well, all of them at the moment, are health improvement practitioners. I don't know if you know much about the health improvement.
I met with a couple of the workers at some networking events, like Chris Simpson. So we've seen a couple of things. We get some things that they're doing in the community to tie in with them as well. So I'm aware of them.
Chris is one of our big Stigma Free champions. He's the guy who manages everything and is just amazing, to be honest with you. But the health improvement champions obviously work within their localities to try and support with a whole load of different health agendas. But they deliver Understanding Stigma and Discrimination workshop, normally within their localities, but they can go without it. But we've got health practitioners, health improvement team working in most of the localities. So they deliver a 2-hour workshop within the communities to individual support groups as well as to professionals potentially working within the area. So that's what the health improvement champions, the Stigma Free champions are.
Oh, brilliant. And so you kind of mentioned a couple of workshops and stuff there. How are people able to find out when those workshops are running and where they're running? Is that kind of similar on the website and on the social medias again?
Yeah, I send them out through Banel and Vaslan and things like that. I'll send the poster out. But if you just get in touch with us through the email, we're really flexible in the sense that we've already got a load of workshops that we deliver personally as a team as well as the Stigma Free champions. But we're really flexible in how we can deliver that. So we can deliver it face-to-face, we can deliver it in teams. If it's an organisation that's looking to get a better understanding of stigma and the impact that it can have within their organisation, we can deliver it in whichever way is suitable for the individual. So just need to get in touch and we're happy to have a conversation.
Yeah, that seemed kind of very apparent from the get-go, is just that getting in touch. Cause I think that can put some people off. Oh, I don't know what email, would this be all right? Is this appropriate? And it just seems a case of getting in touch with yourselves, telling their story, and then you're able to kind of adapt an action plan towards those needs.
Whatever it is, we're happy to, whether it be the workshop, whether it be working through an action plan, whether it's attending, like even with Cocoon Minds, attending one of their events and standing up and talking, or reaching out to the people that turn up to their events. It doesn't matter. We're really flexible. The key thing is being able to get that stigma-free message across to Lanarkshire.
I think you have to be flexible in this day and age. There's so many kind of different stories, so many different experiences people are having. So it definitely keeps you on your toes, this job, by the sounds of it. Any up and coming events?
Yeah, we've got quite a lot going on. We've got the People Stigma Free Network. So that's a network that's been created and started basically by quite a few of our members who want to kind of take action and stand up against this big umbrella of stigma. And we had our first Stigma Free Network back in January. That was the first one. And again, this is something that's managed by the people. Us at Stigma Free Lanarkshire are just literally facilitating it and kind of organising this and that, but it's very much driven by them. Next week, I've got a couple of focus groups where I'm meeting up with the membership of the People Stigma Free Network. And again, they're going to give me the direction and the guidance as to where this goes. So that one's coming up on the 22nd of April, but we haven't secured a venue for that yet.
Okay.
I'll send you the poster and...
Yeah, no, definitely. Use us, you've been on the podcast now, so you can definitely use us to try and we can help publicise the things that you're running, because it really does sound like great work and it's important stuff to be covering.
Definitely. We've also got some work that we're doing with Go-To from Regen FX. Have you heard of them?
No, I'm not sure I'm aware of them.
They're a young people's group in South Lanarkshire.
Okay.
And they're absolutely amazing. We've already done a fantastic piece of work with the young people where we've spoke to them about the stigma that they've experienced, and they were able to share a lot about some of their experiences within potentially the GP services where they've maybe reached out for support. And again, young people face a very different kind of landscape than we have today as an old person. But when they're reaching out and they're saying that they need support, what support is actually available for them? Is there support available for them? Is it a case of just offering medication as the first stop? And sometimes they get a bad deal, young people, where it's kind of like, it's just your hormones, it's just this, it's just that. And actually, we need to be listening to them and hearing that actually they're reaching out for support because it's gone past the point of where it's just your hormones are going one way or another. I
think a lot of people do that. They look at the kind of behaviour of things and they don't look at the kind of underlying reason as to why that is. So I've seen that on the website as well. You've been talking a lot about the kind of what you do with kind of children and young people. Is that, do you go into schools and work with children in the school?
We have done, and it's just so happens that this year that opportunity hasn't come up. But again, if there's any schools that are listening to this and they think that there's something that's stigma free is something that they'd want to be involved in, you just need to drop us an email and we'll happily engage with that type of work. But yes, we've delivered workshops to young people in secondary schools. We've done assemblies and things like that. So yeah, we're happy to engage with schools.
Fantastic.
Amazing.
And before I let you go, Lorraine, there's a couple of things that I'd seen on your website as well that I thought were really good for people to look at as quick tips if they are looking to see how to tackle the mental health stigma. So you have 10 tips for tackling mental health stigma in general, but you've also touched on there's 8 tips for tackling mental health stigma on social media, which I thought was really interesting. Do you want to talk a wee bit about that?
We've got quite a few resources on, because sometimes it can be really hard to be able to talk about stigma and mental health. Those resources are there for anybody to use. They do what they say on the tin, to be honest with you. They're just really quick tips. Yeah. And I think some of the key things is being able to have that conversation and trying to reduce that barrier within yourself to be able to reach out and talk.
Some of the words that kind of shouted out to me when I was reading them was the idea of empowerment and community engagement, empowering people to speak out and make the changes, which I thought was that was quite apparent throughout.
And I think that even if I link back to Liz's story that's on our website, it really is a case of just being able to take that first step and reaching out. And the empowerment that does come from that and the tools and the resources that you gain from that is really empowering. But I also think that for other people who aren't experiencing what we're talking about today, to be able to listen empathetically. Yeah. We had at the People Stigma Free Network, we had a speaker called Jenny Hutton. So she's the mental health, the manager of mental health across Lanarkshire within the NHS. And she talked a lot about how our brains are wired up to be naturally empathetic with other people. And there's a specific neuron in our brain. I think it's
sciencey aspect.
Yes, I think it's called the Gandhi neuron. Not that
it sounds about right. It sounds good.
It does. And that part of your brain looks at actually that we're wired to be empathetic to other people and to put ourselves in their situation. So that's why if somebody trips over, we would naturally flinch or something like that. So we do physically react and empathise with other people, whether that be a physical incident or a mental health incident.
Yeah. And I think that definitely becomes a lot easier when hearing people, hearing it from the kind of horse's mouth almost, in terms of hearing real people talking about their real experiences. We had that on our last episode of the podcast. We had a couple of people who'd been in our service sharing their personal reflections, and it sounds a lot better coming from them than coming from me paraphrasing what they're saying. You know, you're hearing the voices, and the exact same what you're saying with Liz as well, actually hearing her real words of what she's been through. You know, that's invaluable.
I think for somebody who's going through a bad time at the moment, for them to know that actually other human beings are wired to be empathetic, that it is, we can't help it. It's our brain. It's telling us what we're doing. Might just break the barrier for somebody who wants to reach out for help. And just knowing that people aren't wired to be mean and unkind and horrible, that we are wired to look after each other, it can sometimes break that barrier for somebody reaching out for support.
Brilliant. I think sometimes what as well into it's that feeling of I'm alone. And people don't realise that you're not alone. So you should reach out. You know, that's why other people are there.
I'm glad you touched on that underlying science impact as well, because we don't talk about these things enough to know that there is underlying predispositions to behave in certain ways, and that's not always to be judging, to be mean, but there is that kind of sense of empathy within all of us, which is nice and empowers people to feel more open to talk.
And I think the big thing that Jenny was getting across at that thing was that as much as stigma is very much a massive thing within our society, and the judgment of people and the treating other people mean, actually it can be unlearned, because we are naturally programmed not to be like that. So just knowing that can be reversed, that stigma doesn't need to be something that's present in our society today, is, I found, quite powerful.
Well, that's what kind of stood out to me when we looked on the website, and it was the 8 tips for tackling mental health stigma on social media. Number 8 is be conscious of language used when you're talking about mental health. And I think probably in the west of Scotland we all kind of need to do that, don't we? That's probably where the first barrier came.
I think so. One of the things when we're delivering the workshop, one of the things that we talk about is in the west of Scotland, it is very easy to say, especially today, that the weather's mental and stuff like that. And just that little change in wording, and instead of using the word mental, be saying something like, oh my goodness, it's wild out there. That just makes such a big difference to taking that association away from. So your language is really important, because it does have an effect on others.
No, well, listen, thank you so much for coming in and taking time to talk us through your role and the work that you and your team are doing in tackling stigma of mental health. It's been really interesting, worthwhile for myself and Michelle. I think Michelle
amazing. Honestly, thank you so much for all that information.
Really, really useful. To be honest with you, I could go on another 20 minutes, especially about, I'm going to go on this one, our volunteers. Right now, we've had a massive push on volunteers. So again, if that was something that anybody was interested in,
so volunteering. On that. Is that again just kind of in terms of emailing?
Just email.
Again, in the interest of...
Just let us know that you're interested. And again, the commitment can be anything from a line for social media that talks about the recovery potentially, all the way through to doing something like what Liz done with the podcast, or something bigger. So,
and that's both South Lanarkshire and North Lanarkshire that you can get.
We work Pan Lanarkshire.
Fantastic.
Amazing.
There you go. Brilliant. So for the listeners back home, again, it lets you know that there is support out there. Hopefully with this new platform, it's something that we can continue doing with yourself and other local services, delivering that support to further spread the awareness of mental health. Lorraine, is there any other information you want to help, publicising or sharing before we let you go?
Again, like I said, I could go on for another 20 minutes. I better stop now.
All good. No, but yeah, we're all in it together. So thank you so much for coming and talking about that. We're going to take a short break now before rounding things off on this episode. When we come back, we're going to look to summarise what we've covered today.
Have you ever wanted to share your story, explore ideas, or simply have a chat that reaches beyond the room you're in? Well, with Lending Voices, you can. We're a free audio recording service based in South Lanarkshire Libraries, giving you access to easy-to-use recording equipment, whether it's for a podcast, a personal project, a creative piece, or even just recording memories. You don't need to be a tech expert. Just bring your voice and we will help with the rest. If that sounds interesting, get in touch. Pop into your local library and ask, or email lendingvoices@library.s-lanark.org.uk. Because sometimes the best way to share something is to simply press record.
Yeah, it's about time we advertise these guys for the work they do in the community and the opportunity they're giving people to experience making a podcast. And it is such a good platform. I can't stress highly enough. You know, not only the support that they've shown us up until now, but just the work they're doing in the community as well. So Dave, I'm looking at you here. Apologies it's taking this long to thank you guys and give you a shout out. And I'm surprised you're still letting us use the equipment as a result of it. Seriously, the Lending Voices team are one of the main reasons that we are recording this today. So thank you so much for your help so far. They've been very helpful, very patient with us on our podcasting adventure. We genuinely could not be doing this without them. Recommend if you enjoy podcasting, you know, maybe thinking about starting up your own one, you know, just maybe want to learn more about the process, definitely check them out. Before the break, just there, we were treated to some invaluable insight to the Lanarkshire Links Stigma Free project. Michelle, how did you find that?
Yeah, I think everyone we covered there was amazing. Lots of useful information and tips to take forward and start using. I really enjoyed the information on empowerment and community engagement. I think this is amazing. And as the communities, we can work together to beat stigma and make people in our community feel safe to talk.
Yeah, absolutely. And it's, you know, we're all in it together. And it's nice kind of having somebody else on that's sharing that ambition as well.
Yeah.
And what I found interesting, something that we've not specifically touched on today, was that social media aspect. And I first came across this on their website as well, and it was nice that Lorraine was able to come in and talk a bit about it as well.
Yeah.
The idea of tackling mental health stigma on social media, because that's, you know, that's such a big part of the culture these days.
Yeah.
So if you check out their website on the Stigma Free Lanarkshire project on the Lanarkshire Links website, they have tips on how to kind of combat stigma specifically on social media and tips in general. And just wanting to kind of touch on some of the tips that you've seen in front of you, Michelle.
Yeah, definitely. So I love the word challenge. I feel that when we're talking about mental health, challenging means educating. The more we talk about mental health, the more we break that stigma. Learn more. There's so much more information available out there, whether it's online, libraries even. But remember, if you are speaking to someone who needs to reach out for help, or if you find yourself struggling, we break the stigma by talking about it and reaching out for that help. And remember, you're not alone.
Yeah, that's the main thing, is that you're not alone, and it can feel really isolated when you're struggling and with yourself. So that idea of kind of challenging that stigma, you know, talking openly about your mental health, that's just some of the kind of tips that they touch on in the Stigma Free team. They also advise you to follow at SF Lanarkshire on social media as well, and they look for people to kind of share our hashtag Care to Share campaigns, just again further spreading that message of mental health awareness. So if you have a bit of free time, definitely check out some of the stuff on that website, along with what Lorraine's said to us earlier. And the comparison with other people, we kind of touched on that there as well, you know, that especially on social media, you know, we try to find that sense of normal by comparing yourself with others. Yeah. And there was a colleague that I used to work with in our service, and I'm going to give him a wee shout out in case he is listening, because I don't want to steal it, I don't want to get copyrighted from that. But his name was Craig, and he used to have this term in saying that comparison is the thief of joy. And that just resonates with me, and you know, that the part that social media has to play in that.
Oh, that's amazing. I've never actually heard that before. Hi Craig, if you're listening, remember me. That's actually a great way to put it. Comparison is the thief of joy.
Yeah, no, it's a cracker. He's left his legacy with that one.
Definitely.
And I think that's where we'll leave things today. So hopefully we've been able to, you know, play our part by addressing stigma on this platform and ultimately challenging it as a result. And that is the challenge for you as the listeners, I suppose, as well. You know, join us in creating this new sense of normal, person by person, you know, trying and making it more of an accepting society, so that one day, you know, just one day, we may be able to be an advocate for our own mental health and discuss how we are really feeling without that fear of being judged and being labelled as a result. Yeah. Any last words, Michelle?
Oh, great to be here. Hopefully I make the next one.
Hopefully you make the next one. You've been invited back. Anyway.
Oh, amazing. Thank you very much. No, it's been amazing. Thank you so much for your time, Jamie.
Yeah, no, thanks for joining us today as well. So as always, stay safe, take care of yourself and each other, and we'll see you next time.
Bye.